Hey everyone, Ali here. Welcome to another edition of What Would Ali Do? So a question that we get very frequently is, what do I do if I'm getting a bad online review? Now this could be from a patient, it could be from a former employee, which we'll do another video on. But let's talk about what happens if you get an online review from a patient. Now, is it something that happens? Of course. Is it something that is super stressful for most of us? Absolutely. There's no one who's immune to this because it's the reality of our world, quite frankly. Some people, at any inconvenience or any, gripe they have, they go and they want to write an online review because they think it's their right. And so it is what it is. Unfortunately, we have to all deal with it. Most of the time, what my experience has been with a lot of our clients and even at our own firm, it comes down to billing, right? Someone's just upset that they had to spend some money and sometimes they don't feel like they got the value. And so how do you handle that, right? How do you handle that? And it's not easy when you're a professional because you can't really talk about someone's clinical care. You can't disclose, things about them because it's going to be violations of HIPAA and it's going to be violations of your dental board, laws regarding patient disclosures. And so you got to be very careful. My recommendation in these kind of scenarios is you have to decide as a practice whether you're going to reply or you're not going to reply. And what I mean by that is not just for that review, but for all reviews, right? For all reviews. If you're the kind of practice that replies to reviews, then you should also reply to the negative ones. If you're the kind of practice that does not, reply to reviews, then you don't need to, if you don't want to, reply to the negative ones either, or just let it sort of sit there and maybe the positive reviews will kind of mute the impact. But what I would recommend is one, acknowledge them and their feelings. Definitely don't attack them. Let the user know, and the user and the audience is really who you're targeting with your response, right? It's not that you're trying to change their review because most people won't. What you're doing is you're letting the world know that you care and that that's not, what the standard that you set for your practice, and that you're going to try to do better. And that's really all that you need to do. Any more disclosure, like, you haven't brushed your teeth for 5 years and then you come in here, of course you're going to have cavities. Avoid that kind of talk, okay? Or anything similar to that you want to avoid. But I think acknowledging their feelings, making clear that that's not the standard that you set in your practice and that you're going to try to do better is really all you need to do, and usually has a really strong impact. If you have any questions about this, let us know.